All right, hi guys. My name's Megan. I've also got Ree here who will pop into the screen from time to time. We're from the physio department at the Wimmera Healthcare Group. Today we're just going to be delivering what would have been a part of your antenatal classes, but obviously with coronavirus we aren't able to get you all here in a group. So I know this won't be amazing, but it's hopefully you'll still get the information out of it. You'll get all the information in the booklet as well, so don't stress if you can't see the slides. But we'll get started. First, we need to acknowledge the traditional owners of the land on which we meet today and their elders past and present. We acknowledge and pay our respects to the 5 traditional owner groups of the Wimmera region. I won't attempt to say them because I'll ruin it, but you can read them there. So welcome everyone to our first pre-recorded antenatal group, and we're really hoping that you get a lot out of it. And if you do have any questions at all, feel free to call us at the physio department at the Horsham Hospital. All right, so today what we're going to be going through, we're going to talk about some body changes that you all would have experienced so far. We're going to talk about exercise during your pregnancy, the do's and don'ts. Definitely going to be talking about your pelvic floor and how that's affected with pregnancy and labour. Some common pregnancy-related conditions that I'm sure you're all probably going through at the moment, and how to fix them or how to treat them. Caring for your back, what can happen to your core or your abdominal muscles during your pregnancy, and also go over some posture and some advice with a newborn. So first up, body changes. So if you're all here, I would ask you what sort of changes you've experienced. But
Megan, did you have any changes during your pregnancy?
Yes. Well, I can say I definitely got a lot bigger, especially in the tummy area. So you have your weight distribution obviously comes out and affects your spine. You get bigger boobs. My sense of smell really changed. So like I couldn't stand the smell of like raw meat when I was trying to cook tea. I couldn't chop up raw meat. Some people report like their hair becomes shinier or their hair starts to fall out. Some people say their nails are like shinier and stronger, and other people say they're really weak or brittle. Some people's skin breaks out in pimples, and some people's skin is the best it's ever been. So everyone's experience is very different. We'll see if we got them all. So bigger belly, bigger breasts. Yes, swelling of the feet and ankles is really common, and we'll talk about that a little bit as the class goes on. Changes to hair, skin, and yeah, your senses. You guys are pretty lucky that it's sort of getting colder at the moment too while you're pregnant, but the people that are heavily pregnant in the summer months, they really feel the heat and it's really, really uncomfortable. So obviously weight gain during pregnancy is very, very normal. The normal weight range depends on you. It depends on the weight that you were before you got pregnant, how far along in your pregnancy you are. Average is anywhere between 5 and 20 kilos, but you can go online and there are some quite a few websites out there where you can enter your parameters and they'll give you a weight range, a healthy weight range of where you should fall. So feel free to have a go at that. Lots of changes happen inside our body as well that can affect lots of different things. So for example, our cardiac function changes. So our resting heart rate increases by around 15 beats per minute. And we talk about how that has implications on the exercise that you're doing as well. We have vascular changes, so we have a bigger amount of blood circulating in our body, and that's why sometimes we have some pooling of fluid at our hands and our ankles, just because there's so much extra fluid pumping around our body. Our body temperature increases, so if you've been feeling a bit hot and sweaty, you're not alone. Our respiratory function changes. So because we have a big baby taking up a lot of room in our abdominal cavity, when we take a deep breath in, there's nowhere for our diaphragm to go. So it's quite hard to take a deep breath in, which has implications for exercise as well, which we'll talk about in a minute. You get some softening of your joints and ligaments, and that's very helpful when it comes to labour, so your pelvis actually can open up and move so the baby can come out a bit easier. But before you're in labour right now when you're pregnant, that can actually lead to lots of aches and pains and things. And your pelvic floor, which we're going to talk about in a minute as well, goes through lots of changes. You can also get, which we'll talk about again soon, your abdominal muscles or your six-pack muscle can actually kind of stretch, and you sort of get almost like a gap in the middle, and it's very, very common as well. You might have been advised by your doctor or might have read in some of your pregnancy apps or anything that you shouldn't lie on your back after 20 weeks of pregnancy. The reason for this is you have your superior vena cava is a big vein that runs up through your abdominal cavity and returns all the blood from your extremities, so your arms and your legs, back to your heart. When you lie on your back, the weight of your growing baby actually can squash that vein, bringing the blood back to your heart, and it can cause, if it sort of occludes that vein, it can cause a bit of lightheadedness or dizziness and make you feel a bit yucky. So if you do lie flat on your back and you are feeling a bit yuck, what you can do is just put a pillow underneath your right hip, so you kind of elevate your right hand side a little bit, and that usually offloads that vein. And sometimes it's recommended that when you're sleeping at night, you actually sleep on either side. I think they recommend the left over the right, but either side is fine. But then again, lots of people can safely lie on their back with no symptoms as well.
Megan, for someone like yourself who like to exercise during your pregnancy, could offloading be something you could do when you're doing Pilates and exercises like that?
Good point, Ree. So I know the gyms and stuff are closed at the moment, but if you're still doing some like chest presses where you lie on your back, try inclining your bench. So if you bring your bench up so that you're not lying flat on your back, you're a bit more inclined. Same with your Pilates, perhaps do a little bit more inside lying, or even just putting some pillows underneath that right hand side. Good point, Ree. So we're going to go more into exercise during pregnancy. So if we skip to the next one. There's lots of reasons that you guys should continue exercising during your pregnancy. So some of the benefits, not limited to this, but some of them are have better body awareness. There's some evidence to say that those who exercise during their pregnancy are better able to cope with their labour. Now, I'm not saying that if you exercise now, you're going to have an awesome, easy labour, but there is some evidence that correlates those two things together. Definitely helps with stress management, and this is a bit of a stressful time. So if you need a bit of help with your stress management, exercise can really help. Helps with your self-esteem and self-confidence. Sometimes when you're pregnant, you just see yourself getting bigger and bigger and you start to feel a bit yuck about yourself, but exercise does help you feel a bit better. It helps to maintain and improve your mobility and your flexibility. It improves your fitness, strength and endurance, just like when you're not pregnant. Definitely helps with your circulation. If you are getting a bit of that fluid pooling in your ankles and your wrists, keeping the body moving will help to pump that fluid around your body and stop it pooling in certain spots. It can actually give you more energy. Lots of people think if they're lying on the couch feeling exhausted and yuck, they're like, oh, I can't be bothered going, I don't have the energy to go for a walk. But actually, if you get up and go for a walk, you end up feeling like more energized and ready to do other things as well. If you are experiencing a few aches and pains, maybe in your pelvis or your back or your hips or anything like that, if you see a physio, they often prescribe certain exercises that actually help to either fix or improve your pain as well. As I said before, there is some evidence that correlates exercise during pregnancy to a reduced length of labour, reduced frequency of medical interventions during your labour, and complications with your baby. So again, not saying if you exercise a little bit now, those things won't happen, but there is a link to those things. And of course, all the benefits that you get when you're not pregnant as well.
Megan, if someone's never exercised before, is it a good time to start exercising now that you're pregnant?
Good question. So the recommendations actually say if you've been very, very fit, then continue exercising throughout your pregnancy. If you've never exercised before, definitely start with you can definitely continue with some gentle sort of walking type exercises, maybe some Pilates, but this isn't a time for PBs. So you're not going to, if you never ran, you don't want to start running now. You got to build up to those sort of higher intensity things. But walking is safe for everyone. Pelvic floor exercises are safe for everyone. They're the best place to start. There are a few pregnancy-related conditions where exercising is either contraindicated, so you shouldn't do it, or you have to take it with a bit of precaution. So by now in your pregnancy, you would know if you had any of these conditions, or your doctors would have told you. But some of those things would be like an incompetent cervix, so your doctor would have said you need to minimise the physical activity you're doing. If you're sort of getting on in your pregnancy with twins or triplets, sometimes just because they can come prematurely, you want to sort of just minimise the pressure you're putting on your body. Other things like hypertension or high blood pressure or preeclampsia. Sometimes diabetes if it's uncontrolled, but if you've got gestational diabetes and it's well controlled, then exercise is fine. And yeah, there's a few other things there. But if you're worried, if you've got a certain pregnancy-related condition or your pregnancy is complicated by something, just check with your doctor first. So just a couple of guidelines. So the intensity of our exercise, we call it low to moderate during pregnancy. So if you're someone who's been doing high impact cardio classes when you're not pregnant, we definitely suggest bringing it down a notch to low to moderate exercises. So what that means is you should be able to keep and hold a conversation while you're exercising. So if you're working so hard, if you're going on a brisk walk that you can't keep the conversation going with the person next to you, you're probably pushing yourself a little bit too hard. So that's a good little guide. You always should warm up and cool down and just increase your exercise gradually. As I said, now's not the time for PBs. It's more about just keeping generally active, not trying to run your first half marathon ever. Your duration of exercise should be about 30 to 40 minutes, and that's for everyone. So if you were someone that would exercise 2 hours a day, definitely drop it back down to 30 or 40 minutes while you're pregnant. And obviously in the postnatal period, once you've recovered from everything, you can get back into what you were doing. Drinking plenty of water as well before and after and during exercise. Avoiding contact sports. Some people in the early part of their pregnancy might continue playing netball or basketball, but as soon as you start to get that belly that's more likely to get knocked, then you're obviously just putting your baby at risk. Wear supportive bra because your boobs are a bit bigger and they can get really painful if you don't have a good bra, and good footwear as well. I feel like these go without saying, but just to reiterate, definitely stop your exercise if you notice any of these things. So you get some vaginal bleeding, your heart starts racing more than it should for exercise, your vision goes blurry, you get dizzy or disorientated, you're getting really bad headaches, you get any sort of vaginal leakage that is not normal for you. If your baby was moving heaps and now your baby's not moving and you're worried about it, or any pain that's not normal for you. All right, we're going to talk a bit about your pelvic floor. So your pelvic floor, my model here, hopefully you can see it, is falling apart a little bit. But your pelvic floor is a sling of muscles that sits, it's the floor of your body really, it sits on the bottom of your pelvis, and it's made up of muscles, ligaments, fascia, and it helps to keep your pelvic organs up inside your body where they should be. It also closes off all the exits of your body down there, so your urethra where your urine comes out, your vagina where your baby comes out, and your rectum where your stools come out. Your pelvic floor wraps around all those tubes and it closes them off so that things can't leak out when we don't want them to. The other function or purpose of your pelvic floor that I didn't mention just then is it does help with your sexual sensation as well. So in this picture, I know it's probably not the best on the film there, but you'll get a copy of the lectures. You've got your bladder here and your urethra where your urine comes out. You've got your uterus here where you're growing a baby, and your vagina where your baby comes out, and your bowel and rectum there. And you can see the pelvic floor muscles here. They go from the front to the back and they actually wrap around all those openings and help to keep them off so we're not leaking out fluids when we don't want to. So at different times in our lives, our pelvic floor muscles can get quite weak. So pregnancy and postnatal after labour is one of those times. So the hormones that we get during pregnancy and just the fact that we're carrying a baby that's putting lots of pressure down on your pelvic floor actually causes the pelvic floor to stretch and become quite weak. Even obviously labour, you're pushing a baby through the pelvic floor, it's going to stretch quite a bit as well. Even just being constipated, if you get constipated a lot and you're always straining on the toilet, that puts lots of pressure down on your pelvic floor. Being overweight, carrying extra weight does as well. Heavy lifting, excessive coughing, and menopause are all different times where your pelvic floor might become a bit weak.
Megan, I've heard that at 28 weeks, it's almost like the baby's putting a kilogram of weight down on your pelvic floor. Can you show us that?
This is true. Let me just show you a little prop here. So if we imagine this towel is your pelvic floor, so it's like a sling of muscles, maybe if you hold the other end. So with your baby sitting in your belly, that's putting all that pressure down on your pelvic floor, so you can see the strain that it's under. So that's why it's really important to do some pelvic floor exercises to help lift that baby up and support it a little bit better. So we'll talk a bit more about your exercises in a minute.
I've then heard that at 37 weeks, it's about 3 kilograms.
This is true as well. So I brought my 3 kilo dumbbell. So hopefully you guys can see, but if we place that on our pelvic floor, look how much strain our pelvic floor is under to try and hold that up. So you can see why you hear about pregnant women maybe leaking a bit of urine because they just don't have the strength to close off those tubes anymore. So very important to look after our pelvic floor. So why train your pelvic floor? So there's a stat out there that you might have heard that 1 in 3 women who have ever had a baby will experience incontinence at some point. Now that stat is true, but it doesn't mean that incontinence is normal. So it's very common, but it can be fixed. So if you start to leak a little bit either in your pregnancy or in your postnatal period, see your pelvic floor physio, see us, talk to your doctor, because there's lots of different things that can help, but you don't have to live with it for the rest of your life, okay? And this statistic is the same whether you have a Caesar or you push a baby through and have a natural. So lots of people think, oh no, I had a Caesar, my pelvic floor is fine, I'm never going to leak. But that's not the case. It's just exactly the same risk. Weak pelvic floor muscles also can contribute to pelvic organ prolapse, which we're going to talk about in a little bit as well. And it improves sexual sensation. So lots of good reasons to exercise your pelvic floor. So the next couple of slides, we're going to be talking about some pelvic floor dysfunction or things that can happen when you have a weak pelvic floor. So stress incontinence is a type of incontinence where when you cough or sneeze or jog and you have a build-up of pressure in your abdominal cavity where your pelvic floor just isn't strong enough to withstand that pressure and a bit of urine dribbles out. Urge incontinence is another type where you get all of a sudden urge to get to the toilet and you think, I've got to get there right now, and you start jogging to the toilet and a bit of urine comes out. You just can't get there in time. So they're the 2 main types of incontinence.
Megan, could you show us the water bottle analogy of stress incontinence?
Thank you, Rhea. I would have forgotten. So this is a good analogy of a pelvic floor. So if we think about our bladder as the water bottle, it's got our urine or water in it. If your pelvic floor is nice and strong, then it's going to remain, the tube here is going to remain closed, no urine can dribble out. If our pelvic floor is a little bit weak, and then I apply a little bit of abdominal pressure, so I cough and I go, or maybe it's not quite weak enough there. And I go, cough, cough. Oop, that was a lot. Maybe not that much water would come out, but you can see a little bit of urine should dribble out. So your pelvic floor needs to be nice and strong to withstand that pressure. Okay, next we're going to talk about pelvic organ prolapse. So prolapse has a bit of a bad rap. So you don't want to Google image it or anything because it won't come up with nice pictures, but it's actually not that bad. But what it is when one of your 3 pelvic organs actually start to drop or herniate into your vagina. So you can get where the bladder here starts to bulge or herniate into your vagina. This picture here is showing a rectal bulge into the vagina. See how the front wall of the rectum's bulging into your vagina? Or you can get one here where the uterus starts to drop down the vagina. And this can cause a range of symptoms depending on which part of the vagina is having the prolapse. So, and very common after having a baby, but it can be prevented by having a nice strong pelvic floor.
Megan, is it true that even women before they've had a baby can have a prolapse?
This is true. So we see lots of women from all ages, all types of life that have prolapse. So I'm just thinking of one example that I've had recently who was a woman in her early 20s, no babies, but she was right into gym and weightlifting and bodybuilding. So she'd been lifting really heavy weights, had a bit of poor technique where she wasn't using her core muscles and bracing her pelvic floor, and all that pressure when she was straining, lifting those weights, she actually ended up with a prolapse. So had to go right back to the start, do lots of rehab to strengthen her pelvic floor before she could get back into it. So, and on the other end of the spectrum, you might get elderly women who over time maybe have gone through menopause and their pelvic floor is weakened, and then they might just be doing a bit of gardening or something and just a little bit of extra strain, and they've ended up with a prolapse as well. So lots of people get them at different stages of their life.
Megan, could you show us the prolapse chicken?
I can.
Give us a bit of,
I can. This is one of our favourite props, so hopefully you can see it. It's a prolapse chicken, but pretty much what it shows is the same thing as stress incontinence. When you have a build-up of abdominal pressure, so if you were to go out and go for a really big run and you haven't properly rehabbed your prolapse yet, all that pressure can sort of push your prolapse down. Now, it's not usually this bad that it actually pushes a big egg-like thing outside of you, but it can feel in your vagina like something's dropping down, like people report a tampon falling out kind of feeling, and it can cause a bit of aching and heaviness in the vaginal area. So it can be pretty uncomfortable and really dictate people's lives if they want to get out and go running. So really important to rehab your pelvic floor properly and protect it while you're pregnant at the moment as well. This is just another analogy of how to explain a prolapse. So it's the boat in the dock analogy. So if you imagine the boat here is your pelvic organ, so your bladder, your uterus, and your rectum or your bowel. The water here is helping, that's your pelvic floor. So that's lifting the boat up from the bottom, helping to keep it up. And these ropes here are the fascia and ligaments that help to keep your organs suspended in your pelvis, just like they're keeping the boat suspended on the water there. Now in this picture, if you notice, the water's gone. So that's when your pelvic floor is really, really stretched and weak. Then it's no longer supporting your pelvic organs up from the bottom, and it's putting lots of strain and pressure on those ligaments and fascia as well. So then for this person, if they did lots of pelvic floor squeezes, rehabbed really well, and got their pelvic floor tighter and stronger, then it would lift their organs back up, so there's less strain, things aren't dropping down as far, and they'd feel a lot more comfortable. So how do you do a pelvic floor squeeze? That's the next question. It's hard to know if you're doing it right or not because it's all up inside of you, so it's hard to feel. But what you can do while you're sitting there, what I want you to do is imagine that you're urinating and you're trying to cut off the flow of urine midstream. So when you're doing that, the muscles you squeeze to do that are your pelvic floor muscles. So when we say you should be exercising your pelvic floor or doing pelvic floor squeezes, that's what we want you to do. We want you to squeeze your pelvic floor and then relax. Another good way, if you're really not sure, you really can't feel what you're doing, if you get a few minutes alone where you can get undressed, take your pants and undies off, get a little hand mirror, so like your compact mirror, have a look down there, and what you should see when you squeeze your pelvic floor, you should see the skin around your anus tighten up. So it should really tighten up, everything tighten up, and then when you relax, you should see the skin around your anus relax. And that can just be a good little bit of feedback for yourself to see if you're getting the right muscles working or not. The other thing you can do, normally you can come in and see one of us pelvic floor physios and we can do an internal examination and check if you're getting the muscles contracting. At the moment, we can't do any face-to-face appointments here, but one of the private physios in Horsham is still doing some face-to-face appointments if needed. But hopefully soon you'll be able to come back. How many exercises and how long for? Normally, everyone's very, very different. So if we were to assess your pelvic floor, we would tailor an exercise program to your pelvic floor and what you need, just like you would with any other muscle in the body. If you wanted to get big guns, but you only had really tiny little biceps to start with, you'd have to do lots and lots and lots of bicep curls if you want to get stronger. So same thing with your pelvic floor. Everyone's different, but for pregnant people, it's agreed that you're pretty safe to give a generic program where you hold each pelvic floor squeeze for 3 seconds and try and do 10 squeezes in a row 3 times a day. So you end up doing quite a lot, but the more you can do, the better at this stage. Another good thing to add in if you can is to do some what we call quick flicks, where you're just turning your pelvic floor on and off as quick as you can. And if you can do 10 of those in a row as well, then you'll be putting yourself in a good spot to start your rehab after you deliver.